Okay, so this was a patient who had had a DNC 2 months prior, and she was still bleeding. Anu is asking for Doppler, which I've got here. Yeah, so she's guessing an AVM, and I haven't even gotten to the more dramatic images yet. But we can see here that part of so the endometrium itself is actually mostly normal. It's not that thick. It's getting a little, has a little cystic space here, but most of the abnormality is actually in the adjacent myometrium. So a little bit of the vascular issue was here in the endometrium, and then most of it was in the myometrium. And then we've got this abnormal waveform. It was almost 60 centimeters per second. It had a lot of aliasing. And it actually also had this spectral broadening, which is what Dane talked about last time. So, and then here's power Doppler. And then on MRI, we can see that on the T2, there's all these flow voids that are centered within the myometrium here. So yeah, great. This was a uterine AVM. So just a couple of words about uterine AVMs. These can lead to catastrophic bleeding. Actually, the acquired form is more common. This is usually from DNC or C-section. And in that case, they're more technically actually AV fistulas, but they tend to have multiple like vascular channels because there's so much vascularity of the uterus. So we just call them AVMs. More rarely you can get congenital ones. You'll see this vascular tangle that's centered more in the myometrium rather than the endometrium, as would be seen with retained products of conception. And they'll have a lot of turbulent flow. So you'll see all of that aliasing, spectral broadening, and low resistance waveforms. And if the peak systolic velocity is over 60, this is more concerning. When it's in the 30 to 40 range, they may even resolve on their own, but above 60 is more concerning. These are treated with embolization with a variety of materials, trying to get into the smaller vessels, and usually really do well. And just one quick review of what Gane talked about last time, which I learned a lot from. So there's plug flow, which is when everything's going at the same velocity, such as in the aorta. And the same velocity is going to be this thin band here because they're all traveling at that same velocity. In more medium-sized vessels or smaller vessels, you'll get laminar flow where there's more spectrum of flow, but not necessarily through the entire spectrum. And then when you have turbulent flow, such as in an AVM or some kind of after a stenosis, like in his renal artery stenosis, you'll get the spectral broadening where you've got lots and lots of different velocities here filling up the entire spectrum. So that's spectral broadening, and we can also see that there's low resistance here. So that is more common to see low resistance in an AVM rather than the high resistance in retained products. Any questions?